Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and today I'm really excited to introduce Lacey and Martha of Meridian Financial Services, who I've brought on to partner with in helping my office with insurance coordination, billing. Essentially, they are a concierge who's going to help guide you, just like a concierge in a hotel is going to tell you the best places to eat and totally take care of you and get your car for you if you need to know somewhere to go in a foreign area. They are going to be a concierge for you with how to guide you through your dental insurance and how to maximize your benefits. I'm really excited in our partnership thus far in the regard that they've just offered a tremendous level of customer service. So if you ladies would like to speak about what you do and how you work, I would love for our patients to know more.
Yeah, absolutely. Thank you for that introduction.
That's awesome.
We're happy to be here, and I appreciate all the kind words that you shared. We like to work as an extension of Dr. Vane's team. And even though we are, not working necessarily in her office, we focus on taking great care of every patient, helping them utilize their insurance benefits, helping them understand their insurance benefits, helping them understand their account information, and really just answering any questions that you might have in regards to financial information for Dr. Vane's office.
We're here to support you in your dental needs and help you get what you need.
Yeah, what I found really tricky is having previous team members who think of the paper submissions or electronic submissions as dealing with insurance and really not understanding the sub-languages of it. Just like if I didn't understand that my car insurance didn't pay for my flat tire or for my gas, or that my headlight goes out on my car and that's not covered. And it's rare that someone would call their car insurance, and for me, I have State Farm of 35 years I've had it, and I could then say, oh, this is ridiculous. This is absurd. I assumed this would be covered. This is my car. Or someone scratched my car. I shouldn't have to pay a deductible. So people tend to not do those things with certain insurances, but they do it with dental because it's very obscured in their understanding, because they assume it's just like medical, in that you just walk out and someone's going to bill you, and then you might get a couple bills that you ignore, and eventually it gets settled or something's adjusted off, and then you wait for your bill later. Whereas in dental, there's a lot more that goes on up front, and then there's a lot more denials, and I feel a lot more dishonesty that goes on. I'm really upset with the way dental insurance has changed in my 20-year career. So if you don't mind just talking about how you can help the patients, that would be wonderful.
Absolutely. And we've found over the last 20 years as well, there's just been so many changes in dental, and we've seen a lot of change in dental insurances and the way that they process things. And of course, we want to work as an advocate on behalf of the patient so that they can utilize their benefits in every way possible. Martha, you want to talk a little bit about the history of dental insurance?
So dental insurance started back in the 1960s, and it was meant for preventative care. I think a lot of patients have the understanding as far as comparing it to medical, that it's just going to take care of them. It's not meant for full mouth restorations. It's, in the 1960s, the maximums was like 1,500. It's not more than that now. So the basics is for preventative, maybe a filling here or there. But if there's full construction needs, anything like that, there is a cost to it.
Yeah. One of the most common things too, I think, Martha, is that in that benefit amount, the insurance doesn't just come and hand you, whatever your maximum is, and that's a common misconception. Typically, I like to describe dental insurance as a reimbursement
or savings plan.
So the patient or the employer or a combination of the two will contribute monies each month throughout the year. And then as the patient has needs, then the insurance company will distribute them in a percentage or in a fee schedule, a certain amount per procedure, back to the patient throughout the year, based on the types of procedures that they're needing. And so it isn't something that you just get, your lump sum and you can apply it to whatever you need. And that's definitely a common misconception within the dental insurance that we find.
Right. I often hear patients saying, well, I have $1,500 to use this year.
Right.
And you're like, great, yes, that will go towards your cleaning, that'll go towards your x-rays, that'll go towards your exams. But if you've been missing a tooth more than 5 years, it's not going to cover that. Even if it's a brand new insurance and you've never used any of it, there's a lot of internal language that says we're not going to cover this. Or if I have a patient with really crooked teeth, they'll say, well, great, my insurance is going to cover it, right? Otherwise, you said I need it. Sure, but there's an out and out clause that says we will absolutely not cover this. Just like homeowners insurance doesn't cover fire or flood, you have to have separate insurance plans for that. Insurance, even if you have $1,500, like you said, they're going to parse it out however they see fit or based upon their rules.
Absolutely.
Including frequencies and other things that might apply, and it's individual per plan. In 20 years, I don't even understand them all.
Absolutely.
So.
And one of the things, that's why I always encourage patients to make phone calls to their insurance company directly, ask questions, ask detailed questions, and knowing that, that there are plan exclusions. Like you said, there's languaging in the plan. There are certain procedures that some insurance companies just don't cover at all.
No.
So I always encourage patients. The relationship is between them and the insurance company. And as much as the offices that we work with, they do their best to make phone calls to the insurance company to ask questions, there's very limited information that the insurance companies will actually give to a provider. And so the most information will be given between the patient and the insurance company themselves.
Right. And I pay someone to sit 45 minutes, an hour on the phone, and literally that person could be giving the wrong information. Even if I said, I spoke with so-and-so on this date and you have to honor it, there's no such thing. We get the best we can. But what I love about working with you is, unlike people in the past who knew insurance, is you are able to guide a patient through and possibly even help them get it paid, even if it's not in the language, with your level of experience on having done this for 20 years, collectively for 40 with the two of you together. You used to be both office managers who worked in dental offices and say, hey, you know what? Here's what you should try. Or if you call and you say this, you're going to have a much better chance of getting this paid than if we just resubmit the piece of paper, whether it be through mail or electronic. They're just going to say no again. So let me help you with that information.
A lot of times we have to actually have the patient get a hold of their plan documents. What does their plan state, so that we know, an example, a crown. What are the terms that they cover a crown? And it just, a lot of times it's verbiage and just kind of digging a little bit deeper and just exploring.
And we find
plans.
that when we can partner with the patients in that way and they're willing to take the time with us to work through that, then, as you said, there are times when we can get that decision denial to turn around. But it's definitely a partnership. It isn't something that I would ever tell a patient, just leave it in our hands and walk away from it. Having that partnership is what makes them receiving their benefits successful.
They're paying for the insurance, so they are their own advocates.
Yeah. You know what? I'm going to change the language from insurance concierge to insurance therapist. So, because I think you guys are like a therapist where we lay down on the couch and say, these are my dental problems, help me fix them. So thank you for your therapy, because I think having a friendly voice too to guide you through is really the key, because it is something that is so upsetting, especially if someone tries calling themselves. They're going to get the same runaround that we would if we call. Even as a professional, you're put on hold for lengthy periods of time. You get someone who may have had very minimal training and that just says, well, it's just not covered.
Yeah.
oh, but why? Tell me more. Or like, what do I need to do? Can I do anything? No, this is what it says. Okay, thank you, click, So if they can turn to you, that's a lot more helpful. And even if it was still denied, just having a friendly voice who explains it well, and then you say, now I understand. That makes a lot of sense.
Absolutely. It can be a very frustrating process, and we are here to help and help in any way that we can.
Awesome. So your contact information is on every statement that you send. Email, they can get on the phone and they can ask you all questions, which of course we're always in constant communication, but it is your area of expertise.
Yes, and we provide multiple ways. You can text us, you can email us, you can call us. So we're available to patients. I know a lot of times patients work the same hours that we do, and so we actually have people on our team who are available at various hours, even into the evenings.
Wow, that's awesome.
It's better for patients, then we want to be available. I know Martha and I both have taken time even on weekends to talk with patients, because we know they're busy as well, but we want to help them and we want to work with them. And if it's the best time for them, then that's what we'll do. So
that's phenomenal. That is phenomenal. So if any of our patients do have the opportunity to speak with you all, they will see how amazing it is to work with you. So thank you so much.
Yes, well, thank you. We're happy to be here.
All right.